therapist, physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Because
therapist.
we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So this video is how to perform nerve flossing, which can help sciatica. This is a video that's part of a series of videos on sciatica. If you go to bobandbrad.com, our website, and go to the program section, you'll find the one on sciatica. And you may want to watch some of the videos prior to this one, because you may not need to do this exercise if some of the other exercises are working.
Right. As a matter of fact, we kind of prefer those, check those out first. And like Bob said, if they work, this one's really
because the problem with this one is it can help, but it can make your pain worse. So you got to be very careful with it.
Right.
And we'll tell you how to do this so that to prevent you from getting a flare up and you being upset with us. So, all right, so we'll start off. This we're gonna actually, what you do is floss the nerves just as you'd like to use floss to glide through your teeth and clean them. We're trying to pull the nerve from one end while releasing it from the other. What happens over time when you do that, it actually can desensitize the nerve, so it's not as sensitive to pain.
Right.
So, in the end, what we're trying to do is decrease your pain.
Sure.
So,
right.
Again, you're going to do very careful. We're going to do just 10 repetitions. And after we do the 10, we're going to wait a day or so to see how the pain did.
Right.
So let's do the 10, and then we can talk more about that, Brad.
Sure, you bet.
So Brad's going to show it from the side. Brad's got some tape on his ankle, which will show very nicely what the ankle is doing while we're doing this exercise. So we're assuming that on this time that the pain is on the left side. You just reverse it if the pain was on the right side. But what you're going to do is you're going to go ahead and extend the neck and the leg at the same time. So you're straightening the knee and putting the neck back at the same time while you're dorsiflexing the ankle.
So pulling the toes up, you can see the yellow tape as I pull.
Yeah.
That's dorsiflexion. And keep in mind your back is actually going to arch.
Yeah, be nice and straight.
Yeah, and look like you're looking up toward the ceiling behind you.
Yep, arch. We're doing this very slow right now, but you're going to be doing this much faster. We want to just show you. All right, then you go ahead and flex the neck, flex the knee, and push the foot towards the floor.
So you can see I'm pointing the toe down towards the floor. You have to make sure that the leg of the chair or wherever you're on doesn't get in the way.
Yeah, that's we forgot to mention that, Brad. You need to be on a high mat or bench or solid table, something where you can actually swing your leg underneath. Otherwise, this isn't going to work. You can't do this on a chair where your foot is hitting the floor.
Right.
So it can be a little difficult to find the right surface for this. So that going up like that and going down like that, that's one repetition. And you're going to do 10 of those. And we'll show you about the speed that you want to do it at. So we'll start off with number 1, going back, straighten the knee, going down.
And when you go down, your back does slouch, actually.
Slouch a little bit, yep. Coming up, going down.
Now, typically, the part where it's going to irritate the nerve, wouldn't you say, Bob, it's going to be on the up extension.
Exactly.
And when you pull on a nerve that's sensitive, it can be painful, and you're going to feel it not in your ankle, but typically in the leg or up in the back even. So be very cautious. If it starts to hurt, don't push into it. Just respect that and go the other direction.
Yeah, if you can only go up so high and before the pain really gets to be too much, then stop and head back down again.
Right. Again, this is, Bob said, this can really flare it up. So don't have the attitude, no pain, no gain, because that's not going to get you anywhere.
No, you won't get accustomed to this. This is not something that, over time you'll go, okay, if I just keep stretching, it'll get better. That's not how this works. So again, you can do repetitions. You're going to do 10 reps. Then you're going to wait a day. We can stop now, Brad.
Yep.
If there was no pain from this, or it's slightly better, then you can do it once a day.
Right.
Throughout. If it did get actually worse, then I want you to wait 3 or 4 days, or maybe a week, and try it again. Before you try it again, though, what I want you to do before you do it is to actually lay on your stomach a little bit before you try it.
Okay.
If you can't lay flat, you can lay on pillows. We've done that before.
Where you put the pillows underneath.
Right.
We did show that on a previous video.
Yeah, so you're going to lay for a couple minutes and then try the exercise.
Okay.
Same thing, do the 10 and see how it is the next day. If it's worse, you're going to say, you know what, I can't do this. I'm just going to stick with some of the other videos we have,
Right.
which we're going to talk about how to reduce your pain makers
Sure.
throughout the day. Just by reducing the things that are causing your pain can quite often take away your sciatica
Sure.
too. So don't get discouraged if this stuff isn't working. We
Right.
got a lot of other ways to tackle this. So anything else you want to say, Brad? So
No, nope.
Okay.
That's good for now.
all right. Thanks for watching.